What if someone said that you, a woman, have a broken anatomy, one that is not good enough to be pleasing for men? What if that someone is a doctor, someone that you've put your full trust in, someone that is respected in the community? Will you let it pass by, or will you fight in every way to prove him wrong? Hi, I'm Sultan, and today we're going to talk about the love surgeon, Dr. James Byrd. He objectified women based off his views on their anatomy. This story is about medical ethics, consent, and how they evolved in the United States, written by Dr. Sarah B. Rodriguez, a medical historian in Northwestern University in Illinois. Our story starts with Dr. James Byrd thinking that women's bodies are not sexually ideal for heterosexual sex, and only he could fix them. He was a respected gynecologist and obstetrician in St. Elizabeth's Hospital in Dayton, Ohio. He started deviating from a surgery called an episiotomy. An episiotomy is an incision that's made between the tissue of the vaginal opening and the anus to help ease the delivery of a baby. Of course, this incision is stitched after. Dr. James Byrd started to modify on this procedure till a new one started to stem out of it. In the mid-60s, Dr. James Byrd started to develop his own surgery, what he called the love surgery, which is meant to better enable women to have sex after giving birth. Unfortunately for many patients, resulted in the exact opposite effect it proclaimed it had, as it had many post-op complications. Controversially, he started doing so without getting the consent of his patients, till the late 70s. Dr. James Byrd kept on practicing from the late 50s till January 1989, that is almost 40 years in practice in medicine, mutilating hundreds of women in the process. Yet, Byrd, being the reassuring doctor he was claimed to be by many of his patients, kept women silent in his way of telling them that all these post-op complications were normal and okay. He was convinced that he perfected that surgery by the mid-70s, that it can be promoted as a standalone elective surgery to the press and journals. But he was met with immense rejection, yet he never gave up. Dr. Byrd claimed that his surgery will make women have better sex after birth, or an un-Byrd way of saying it, to make them tight enough to physically stimulate their husband adequately. Yes, Byrd usually thought of female pleasure to stem directly out of male pleasure. He claims that he can make any man feel like a stud. Moving on, the medical society's response was also really interesting to look at. As medicine is known as this autonomous, self-regulating profession, the local medical society pushed the hospital that Dr. Byrd worked in to make a special consent form for his surgery. What started the snowball rolling was the women's response to such surgery. They were in sort of a spectrum, where some women were in support of Byrd's in his surgery. They came into interviews supporting him in the late 70s and the 80s. But for most women though, they had very painful complications that they didn't know was a result of his surgery until years later. They felt that the medical societies did not act on time to stop him. The first woman to have a successful lawsuit against him and take him to trial was Janet Phillips, one of his clueless patients that he performed love surgery on, and she did not know that till she sought other doctors years later. Although the trial did not end the way she wanted it to, she still brought the media's public eye and the general attention on what the surgery did. This allowed women to start to speak up and go public with their cases against Dr. Byrd on national television. This is when the Ohio's governor, Mr. Richard Celeste, demanded investigations in Byrd's case from the Ohio Medical State Board. This was in the late 1988, beginning of 1989. That year, he was formally charged with gross immorality and unprofessional conduct. He voluntarily surrendered his license in 1989 to stop further review. The main problem the book discusses was that not lots of physicians were willing to report Dr. Byrd, as he was famous with his threats with lawyers, and basically that meant war if anyone challenged him. As mentioned in the book, they simply just stopped referring their patients to Dr. Byrd, or advised against his surgery. Another problem the book discusses was that not lots of action was taken in time to stop Dr. Byrd, as the Ohio Medical State Board did not formally investigate Dr. Byrd until it became national news. Dr. Sarah B. Rodriguez really shows in an unbiased manner, which is what I really like, the importance of consent in every minor detail. No one wants to go back with more problems than what they had coming in. And I hope it brings awareness that it is okay to stand up against wrongdoing, even in taboo topics. Although I really enjoyed reading that book. Its main weakness, I believe, is that it did not follow a chronological history timeline, especially when mentioning very close dates and very different scenarios, so it was pretty confusing to maneuver through them all. All in all, the writer really makes the book interesting to read and captures you with every detail. Thank you very much for watching my book review.